All right, when we're thinking about artificial intelligence, we tend to think about robots or virtual reality. But we know that the jobs of the future will be changed by AI, and that includes in the healthcare system. Joining us now to talk about the changes that are coming are our medical expert, Dr. Adam Kassam, and his wife, family physician, Naila Kassam. Good to have you both here.
It's great to be here.
You guys were saying this is your first time doing television together.
Yes.
I'm glad it's here in your morning. I want to direct my first question to the clinic. What would AI look like in a clinical setting?
Yeah, so AI is the idea of integrated healthcare system management. And so it was actually initially designed by Professor Geoffrey Hinton at the University of Toronto. And in a clinic setting, what this primarily looks like is real-time patient data analytics that are primarily as a result of increased use of wearable technology.
So what does that mean?
So, for example, if you have a Fitbit that looks at your heart rate and your blood pressure, we can monitor that in real time and make adjustments based on what we're seeing.
And would all that go into like a digital chart?
Ideally, that could be integrated into an electronic medical record that we can see and download information from and be very, very, very integrated with.
And it also, I imagine, helps with efficiency, right? It stops you from having to sit down and do the 15-minute questionnaire.
Absolutely. I think it'll allow us to streamline healthcare services in a very positive way.
All right, how about AI in terms of delivering better health care to patients? How does it help?
Yeah.
So the applications for AI in healthcare are numerous. For instance, AI can help with diagnostic imaging and accuracy, so reading MRIs, CT scans, X-rays. Also, AI can help us determine which patients are going to respond best to which treatments, so individualizing medication and treatment plans in a way.
It all sounds very sort of far off in the future, but really, as Canada is one of the leading countries on AI, it's not really all that far away. Do you guys have an idea of where we can expect to see it happening first?
It's a good question, actually. It's hard to anticipate that, but we know that Canada is a world leader in artificial intelligence, and so our healthcare institutions really need to leverage that expertise across the country, and certainly in places like Toronto, and Montreal, and Waterloo, which are AI hubs for the world, really.
Yes.
We also need our medical students in schools to integrate with engineering faculty to create synergies, and ultimately we need our political leadership to really create a very robust ecosystem for growth in AI.
It means a lot of change to a lot of very old systems. People can be resistant to change. It means it's loss of jobs, it's a loss of a regular way to do things. How do we go about implementing it? Is it political pressure? Is it change within the medical community?
I think it's a bit of both. I think it's allowing us to understand both the pros and cons of a changing system. And so we need to have checks and balances when we implement these new programs, but also have buy-in from a number of different stakeholders in healthcare.
What about a growing population that we see in need is our elderly population and in senior care? How could AI benefit that?
So it's a great question. So AI can really help us detect early changes to seniors' health status. And when we know the early changes, we can intervene earlier. So think if we know which patients are at most risk for a fall, are at greater risk for hospitalization, after perhaps they have wearable technology, which lets us know when anything is deviating from their normal.
Some of the big concerns for patients, I'll speak from the patient perspective, is issues around privacy. Because then you're dealing with insurance, and a lot of times, if you're dealing right now with a senior in your life, they can be very protective, very private about what's going on with their health. So how do you talk through those with patients?
It's a good question. I think as far as patient privacy and healthcare information is concerned, this is a growing concern in the healthcare community as well. I think one of the technologies that will sort of revolutionize this field is potentially the advent of blockchain technology. So being able to de-identify and encrypt data in a way that's extremely secure, I think moving forward, that's going to be one of the keys.
This other idea, the loss of human interaction. I may not want to, type in my data. I may want to sit from you, Dr. Kassam, and say, this is what's wrong with me. Can you help?
And I think that's where AI technologies and development companies need to interact with patients, the family members, and the healthcare providers, so that we make sure we keep the good things about healthcare, the human interaction, the doctor-patient and nurse-patient relationship, but really that we use AI to enhance quality of care going forward.
So is it a threat or a savior for the medical community?
I think it's perhaps neither. I think that we have to look at this as a very important tool moving forward. How do we best use this tool to serve our patients, our communities, our societies, and interact with the technology moving forward is going to be very important, and having input in how it's created is going to be important.
Is there areas of healthcare now that are already using AI?
To a certain extent, again, sort of that certainly in Silicon Valley, the wearable technologies are growing in terms of their popularity, and certainly trying to integrate with more electronic medical records is starting to happen. Certainly with apps and other technology development.
But we're still a long way off from seeing, robots taking my blood pressure when I check in at ER.
I think that's a long way off.
Okay.
I think that's a long way off. I think initially we'll see a lot more behind-the-scenes data collection than anything else.
Okay, well, good to have you both here. Get a little glimpse into the future of our
Absolutely.
healthcare system. Thank
Great
you
to
both.
be here.
Thank you.